Well, it feels like we're back to square one. The vaccine rollout is a lot slower than expected, and as a result, President Cyril Ramaphosa announced that we're moving back to lockdown level 3 as COVID-19 numbers continue to rise. Alcohol sales are more restricted, our curfews tighter, and gatherings are limited. But could this not have been avoided had we vaccinated a lot sooner? Professor Shabir Madhi is the Prof of Vaccinology at Wits University. Let's chat to him now. Prof, too little, too late?
Unfortunately for this resurgence, very much so. For vaccines really to be impactful, you'd probably needed to have the high-risk individuals vaccinated already a month ago. And that is not 40 million South Africans. We needed to have vaccinated roughly about 10 to 12 million South Africans about a month ago to avoid people ending up in hospital and dying from COVID-19 this time around. What we face currently is a rollout of the vaccine in the midst of a third wave, and this particular rollout is going to have a negligible effect when it comes to the number of people that are infected with the virus, as well as the number of people that end up in hospital and die. It will probably serve us well for the next resurgence, provided that we get our act together and are able to actually target vaccination of individuals that are at high risk of ending up in hospital and dying.
Prof. Madhi, members of the Command Council have said that we've had more than our fair share of hiccups in the vaccine rollout with the new variant and, of course, with the J&J contamination. Are other countries experiencing the same kind of problems?
So we need to be clear that those are curveballs that's been thrown our way, but at the same time, there's also been poor decision-making. And I still maintain that, as an example, we should have been using the AstraZeneca vaccine. In fact, the most recent evidence shows that if you had used the AstraZeneca vaccine and topped it up with a Pfizer vaccine, using this sort of a combination approach, you probably would get a better immune response than 2 doses of the Pfizer vaccine. And right at the outset, the World Health Organization had indicated clearly that even in countries such as South Africa, where the Beta variant was dominating, those countries should still continue using the AstraZeneca vaccine. Poor judgment, poor call on the part of our government to actually dispose of the AstraZeneca vaccine, which likely would have ended up protecting a few thousand deaths from preventing a few thousand deaths from occurring. So yes, we have been unfortunate when it comes to the Johnson & Johnson vaccine saga, but it wasn't all. Not due to our own making, unfortunately. Where do we stand right now? So yes, government is going to try to pursue other avenues to gain access to other vaccines, but at the same time, we need to understand that most of the first generation of COVID-19 vaccines are not going to really bring an end to the resurgences that we're experiencing. What they're going to achieve is really protect people from ending up in hospital and dying from COVID-19. So in South Africa, unfortunately, because of the dominance of the Beta variant, which is relatively resistant to most of the antibody that's induced by these vaccines, these are vaccines that are not going to bring an end to the pandemic, to the end to this type of resurgences. But importantly, they will at least alleviate the pressure, the burden on our healthcare facilities, and they will protect people from dying.
Prof. Madhi, quick last question. How do we inject some impetus, new life into our vaccine rollout? It feels as if we've suffered a setback. Well, that's certainly what people on the ground are saying.
So we need to become much more innovative in a manner in which we use the limited supply of vaccine that we do have available to us. There's actually good data which shows that in a country such as South Africa, where up to about 50% of the population have already been infected, those past infections actually does probably protect people from ending up in hospital. But you can actually enhance the protection just by giving them a single dose of the vaccine. So we need to reconfigure the way that we're using the vaccine, and it might well be that in a country such as South Africa, where access to the vaccines are limited, that we actually do some antibody testing at a time when people have been vaccinated, and those people that have evidence of past infection receive a single dose, and we can expand the use of the number of vaccines and get more people vaccinated. So it's an urgent need for us to reconsider the way that we're using vaccines. And also importantly, we need to ensure that we minimize hurdles that are present that prevent people from accessing vaccine. Not allowing people to access the private sector unless they're on a medical aid or over the age of 80 makes absolutely no sense. All that you're creating is creating obstacles and preventing people from accessing these life-saving vaccines.
Yeah, it feels like we should just open up the vaccine program. It'll stop people using disingenuous ways of trying to get hold of the vaccine too. Well, that was Shabir Madhi, a professor of vaccinology at Wits University. Thank you so much again for your time.